The 2014 Ebola outbreak is the largest Ebola outbreak in history and the first Ebola outbreak in West Africa. Despite international action, it rages on, consuming lives, resources and money, with over 2,630 people killed thus far. Fear of the virus also continues to spread and is a massive hindrance to aid efforts. To discuss the Ebola outbreak, I am honoured to be joined by Margaret Ann Harris, the Ebola spokeswoman at the World Health Organization based in Geneva. Thank you so much for joining us. Now, what are the biggest problems facing you in the fight against Ebola?
Well, the biggest problem is that this virus is a very unforgiving virus and it's racing ahead of all the usual containment measures. But we're also dealing with an area with 3 countries that have got the weakest health systems, some of the weakest health systems in the world, and you're dealing with a population that isn't trusting of the authorities because they've been through long civil wars and a lot of civil unrest. So they're not really trusting of people who come from outside and tell them that what they're doing is for their own good. Also that there are some traditional practices in those areas that are different from the kind of practices we saw in other areas with Ebola. So, for instance, the burial practices require that people clean the bodies and spend a lot of time touching the bodies, and this is a virus that is transmitted by body fluids. So those, and finally, as I mentioned, we have the problems with the health systems. They were very undersupplied with skilled health workers in those countries, so they already had the lowest ratios of doctors and nurses to population in the world. And then this is a virus that health workers are very vulnerable to because it's passed by body contact, and if you're dealing with somebody very sick, you're likely to be in contact with them. So 10% of the people who have been infected and sadly died have been health workers. You start with countries that didn't have enough doctors and nurses, and then the doctors and nurses get sick. So we are really struggling to provide care, hospital care for people, because so people are staying in the community and continuing to infect other members of their families and communities. I think those are a big problem.
What are the economic effects of this outbreak?
Well, the economic effects are loss of trade and loss of productivity. So, for instance, in Lofa in Liberia, these are the areas that are very fertile, and this is a period when you would be growing much of the food that feeds not only the country but it's also exported, and those fields are empty. Nobody's growing anything. People, even if they are available to work, are terrified. So nothing much is happening. But then you have external effects as well. There's a real problem getting ships to come to these countries because the shipping companies are frightened that their staff will be infected or that somehow the virus will travel in the ship. That's not likely. That's never happened. That's extremely unlikely. But the shipping companies are as afraid as the local people of the unknown. So a lot of shipping has stopped. We've also seen problems with air transport. Again, a lot of the companies stopped flying. So the normal methods for export and import have stopped. People are not working. So all these things are having a massive impact on economies. And again, the group of people that are being infected and dying, the vast majority of them are between 15 and 45, in the 15 to 45 age group. And that's essentially your workforce. That's the period in which, in most societies, most humans are most productive. So you're essentially carving out your productive group of people, and that's got to have an enormous impact on your economies.
What still needs to be done to help, and what hope do you see?
Of course we see hope, otherwise we wouldn't be working in this area. There is hope because, again, the containment procedures, things that have worked in the past can still be done. But because this is so much larger than the previous outbreaks, we have to have a much greater response. So that means we have to bring in many, many more medical staff. We have to set up many, many more treatment facilities, and we have to reconsider how we treat people. So traditionally you would treat people in a hospital or a clinic, but because it's so widespread and in so many communities, and because there is so much fear, we're looking at providing much smaller units within communities. So finding a place within the community where 3 or 4 people can be, where their families can see them, where we can support their families to care for them, but isolate them so they don't affect the rest of the community, is the way we're thinking of going, because this is more in tune with how the communities, with the comfort of the communities. They would be much more comfortable seeing people cared for that way. Ideally, we'll minimise the fear. Ideally, we will treat people and they will survive. We've seen that where people are treated in hospital, their survival rates are much better than if they get no treatment. So ideally, once the communities see that this is a better way, that their people are surviving, that people are not going off into the unknown, disappearing, and then they never see the body again, which was what was happening in the beginning of the outbreak. And that was one of the reasons the communities were very unaccepting of the approach to treatment. And we are also bringing in a huge number of personnel, huge amount of equipment. The United Nations has mounted the first ever medical mission. It's called the United Nations Mission for the Emergency Ebola Response, and that was put together last weekend. And already they've started sending teams to the base, which will be in Accra in Ghana, so that we can reach out to all 3 countries equally and effectively. That's all starting this week. So yes, I do see hope, because the international community has really got together on this and is determined to beat it.
Thank you again to Margaret Ann Harris for joining us. I'm sure we all share the hope that this deadly virus will soon be eliminated. That's all for now. Goodbye.